Hello friends, this is Dr. Akshata Shanba. Today we will discuss homeopathic therapeutics on leucorrhea. So first we should understand what is leucorrhea, what are its causes, signs and symptoms, and then homeopathic therapeutics. What is leucorrhea? It is the whitish yellowish discharge from the vagina. So in Kannada it's usually called as Bili Muttu. In Telugu it is called Tellabatta. So causes, it is normal before menses, during ovulation and during pregnancy. Normally it is non-offensive and this is physiological, which is basically caused due to hormonal imbalance. So when there is any infection in the vagina or cervix, there is leucorrhea which changes in color and also becomes offensive. So infection can be either bacterial, fungal, viral, etc. Other than infection, the other causes could be either because of vigorous exercise or urinary fistulas or diabetes or ulcerations in the cervix or vagina, or there may be use of contraceptives can lead to excessive whitish discharge, or longer use of antibiotics for some other infections. So that can also lead to excessive whitish discharge. So what are the signs and symptoms? So as we know, leucorrhea is not a disease, it's a symptom which indicates that there is some infection or there is some abnormality present inside the organ. So we have to inquire in the leucorrhea about the color of the discharge, whether it is greenish, brownish, yellowish, etc. Thickness of the discharge, whether it is watery or cheese like, or the odor need to be inquired, offensive odor. If it is offensive, you need to ask what type of smell will be there. So some may say like fish it smells, okay, and non-offensive. Any other associated symptoms with this we need to inquire, like abdominal pain, backache, etc., itching, burning, etc. These will be the associated symptoms with the discharge. So if it is a fungal infection, the discharge will be white, thick, cheese-like discharge and offensive. If it is trichomoniasis infection, it becomes thick, yellowish, greenish, lumpy and offensive. If it is gonorrheal or chlamydial infection, the discharge will be thick, cloudy, yellowish green and offensive. If it is bacterial, there will be thick, whitish, foul smelling or fishy odor. This indicates there is purely a bacterial infection. If there is cervical cancer, fibroids or tumors, there will be brownish color discharge. In pelvic inflammatory disease, heavy, profuse, offensive discharge will be seen. So coming to homeopathic therapeutics. So in homeopathy, we should first differentiate leucorrhea miasmatically. So as we know, psoric miasm, first is the psoric miasm which has a functional disturbance. So here the cause may be either anemia or functional changes in the cervix or vagina. The leucorrhea will be either white, albuminous, odorless and usually bland. Bland in the sense no burning, no itching and all. If it is psychotic miasm, it indicates structural changes. So here the cause may be either hypertrophied glandular cells, non-suppurative chronic inflammation of the cervix or vagina, emotions, stress, suppression of eruptions or discharges. Here the onset and progress both will be very slow. The leucorrhea here in psychotic miasm will be very thick, greenish yellow or dark in color like dirty water and usually acrid and excoriating. The odor may be either offensive, fish brine like odor can be observed. So in syphilitic miasm as we know, it shows the degenerations. That means the pathology inside there will be either cancer of the cervix, cervical erosion will be there, ulcers, any STDs, sexually transmitted diseases, etc. So it involves distant vital organs also, with slow deterioration of general health. Here the discharge will be very thick, offensive, bloody, greenish, profuse or scanty. In tubercular miasm, it is sorosyphilitic, where there is rapid deterioration. So here what happens is, when there is inflammation of the cervix or vagina, it is followed directly to the fibrosis or scar, or local loss of tissue will be there. Ulcer formations also will be formed. Then it becomes a tubercular miasm. So there will be lot of weakness even after ravenous hunger. So now we will see now according to the different types of causes, and according to the different modalities and different odors and color of the discharge, what are the homeopathic remedies we can remember. So leucorrhea from anemia and weakness, if it is there, the remedies we can think here is cinchona, natrum mur, silica. And leucorrhea in young girls, if it is there, sepia, pulsatilla, merksol, cubeba, calcarea, carb. Coming to the gushing leucorrhea, that means excessive leucorrhea will be there. So here graphitis, calcarea carb, lycopodium, sepia, silicea, we are the remedies you see in with the gushing leucorrhea. Acrid excoriating leucorrhea is seen in iodum, borax and merksol. So acrid excoriating leucorrhea you see in the miasmatic, according to miasm, psychotic or the syphilitic miasm will come. So those remedies you need to think here. Pulsatilla is also the other remedy you can think. Coming to profuse transparent leucorrhea, alumina, ferrum iode. Then leucorrhea in menopausal women, sepia, graphitis, sorinum, sanguinaria. If it is old weak woman, you have arsulp, helonias, nitric acid, sickle core. These are the remedies you can think in the menopausal woman. So leucorrhea in pregnancy. If leucorrhea is seen in pregnant woman, cocculus indicus, kali carb, sepia. Then leucorrhea with backache, if it is there, asculus, kali carb, upionum is the other drug which you can think. Leucorrhea with color changes. So if it is blackish, there can be sepia and crocus can be thought. Blackish in the sense it can be brownish like thing. Bluish ambra grigia is the remedy. Brownish, purely brownish, it is ammonium mur, lilium tig, nitric acid, sickle core, silicea. Greyish color, argentum nitricum. Greenish color, carboveg, merksol, natrum mur, natrum sulf, nitric acid, sepia, thuja, sickle core and pulsatilla. If it is milky discharge, calcarea carb, pulsatilla, sepia, creosotum, ammonium carb, borax, conium. These are the remedies you get according to the color difference. Whitish, if it is whitish, purely whitish, alumina, borax, then graphitis, natrum mur, sepia. Yellowish, arsulp, sepia, hydrastis, creosote, sulfur, carboanimalis, chamomilla. Starch, boiled like discharge, few will tell. So there are remedies like borax, natrum mur, sabina and ferrum iode. So leucorrhea with offensive odor. If it is, the offensiveness is like ammonia like urine you can think. So ammonium carb you can think the remedy. Old cheese like, there will be sour smell. Old cheese in the sense sour smell will be there. So there heparsulf, sanicula can be thought. Fish brine like smell, sanicula is the remedy. Green corn like smell, creosotum. Menses like causticum. And pungent smell, offensive. Pungent is extreme offensiveness, there creosotum will come. And putrid smell, so putrid in the sense almost like there will be offensive smell, carbolic acid, caliphos, creosote, sorinum, kaliars, kaliiode, natrum car, sickle core, sepia, colchicum, lechesis and sabina. Sour smell, hypersulfan, natrum phos, sweetish, calcarea carbon, mercor. So according to modalities of the leucorrhea discharge, like whether it is aggravated in the morning, afternoon or night, or because of some activities it is more. So according to that, if we see, so leucorrhea better from washing with cold water, alumina is the drug we have to think. So leucorrhea aggravation during walking, from motion, from movements, then bovista, magnesium mure, then carboanimalus, graphitis, helonias are the remedies. Leucorrhea from rest, fagopyrum is one drug we can think. Then leucorrhea which is relieved by sitting or walking, cactus, cocculus indicus and cyclamen are the remedies. Leucorrhea from contact of urine, so creosote, merxol and sulfur are the remedies you can think. Then leucorrhea only in daytime, so and in night they will not have, only in daytime if they complain, alumina, laccan, platina, sepia, these are the remedies we can think. Leucorrhea only at night, so again alumina, ambragracia, carboveg, causticum, conium, merxol, natramure, nitric acid and sulfur are the remedies. So in this video I have tried to make it simplified, the leucorrhea discharges according to color, odor and all, so that it will help you clinically when a patient comes and tells that the leucorrhea is present more at night, or whenever she washes with cold water it is better, or there is lot of itching, or there is lot of offensive discharge. So based on that immediately you can think some remedies. So then we can go for the constitutional drug. Of course at the end you need to understand the constitution of the remedy of the patient and then prescribe. Thank you.